Dr. Sami was in his 40s, known as an outstanding gynecologist due to his expertise and competence. However, he was suffering from a deep wound after discovering his wife Maryam's infidelity, which led to their divorce. In an attempt to overcome his sadness, Sami began using his profession as an escape. Every day a new patient would come to his clinic, and Sami would exploit these opportunities to avoid his personal pain. In an attempt to overcome his sadness, Sami began using his profession as an escape. Every day a new patient would come to his clinic, and Sami would exploit these opportunities to avoid his personal pain. He would prolong visits and let them exceed the bounds of medical care, discussing his personal issues, and in some cases crossing boundaries inappropriately. One day, Nida, a woman in her early 30s, came to Sami's clinic due to digestive issues and was also suffering from depression after her mother's death and ongoing anxiety due to her difficult financial situation. As Nida started talking about her problems, she noticed that Sami was avoiding focusing on her health. Instead, he brought up personal topics and discussed his own issues with his ex-wife Maryam, seeking Nida's sympathy. At first, Nida was concerned but continued to talk openly about her life. As the conversation progressed, Nida saw how Sami became more open and less composed. She talked about her personal experience in facing sadness and how she found strength in family support and seeking professional help. She told him that using his job as an escape from pain would not solve his problems and might complicate things further. Nida's words deeply affected Sami, and he began to feel remorse for his unprofessional and unethical behavior. He reflected on how he had exploited his patients' emotions and realized that this was merely a reflection of his personal issues. He decided to change his behavior. Sami sought professional help and took the initiative to improve himself. He joined therapy sessions to deal with the pain of his divorce and learned strategies to handle emotions in a healthy way. He also decided to engage in workshops on medical ethics and effective communication with patients. When Sami returned to work after receiving treatment, the changes were evident. He became more attentive to his patients' real problems and returned to a purely professional approach. He started dedicating sufficient time to each patient and listened to them attentively, focusing on providing medical and emotional support, rather than seeking emotional support through inappropriate relationships. Sami's life changed thanks to his experience with Nida. He learned that true healing comes from facing difficulties honestly and seeking help when needed. He became more empathetic and professional in his work, regained his self-respect, and learned that pain is not healed by escaping, but by acknowledging and correcting it. He began offering support to patients in a way that reflected his personal growth and genuine dedication.